Can you believe I'm in the third trimester? Because I can't. Crazy. My goodness. So since the whole second trimester is over, let's do a recap. I've been very lucky even in the second trimester, even with pain or whatever. The big advice that I can give for any pregnant woman is take advantage of when you feel your best during the day. So for example, if your goal is to work out, go on walks, don't wait until the end of the day when you're most likely to have pain and ache and be too tired for it. Go in the morning when you feel great. I walk for 20-30 minutes without pain. If I wait to do it at night, I can't go more than 10-15 minutes and my whole body, it's just my hips. I can feel my hips are shifting, getting ready for birth, and like my hips is just uncomfortable and it's just too painful to be standing for that long anymore. So unless you're bed rest, take big advantage of when you feel your best to do anything, chores, workout, walk, just take advantage of this. And then second, I hope you started your stretches, your pelvic floor therapy stretches, because I haven't posted them and I will start them, but I do my stretches every single day. And I've done it on my first trimester too. I used to stretch a lot before pregnancy, but I switched my stretches to do more pelvic floor focused to open my hips and get ready for birth. And you start this and you can start this in the second trimester. Don't wait until the last minute, because all those stretches are going to help your baby get in position in line with your pelvis, get the head down. Like all of this helps. It's all of this 9 months is getting you ready to give birth. And stretches and the health of your pelvic floor is extremely important for that. I've been very lucky this whole pregnancy. So let's see how the third trimester goes, but I keep going to the pelvic floor therapy. I have birth classes with her planned already. So my husband will come and she wants to do like biofeedback. I'm not sure exactly of the right word, but basically is to stimulate and see how my body is pushing and which part of my body is more engaged, to like learn to prepare and use this biofeedback for the actual birth. But that's my big birth class that I will be taking, because everything else is online. And so that biofeedback is going to be very helpful to know which position my body is actually the best to give birth, because it doesn't make any sense to be laying on your back. Your whole trimester, your whole third and second trimester, we've been told, do not lay on your back. But then you go and give birth laying on your back. Yeah, doesn't make any sense to me. Also, when you're laying on your back, your uterus cannot fully contract faster, and I don't know the right word, but it takes too much work. It's like you're doing a crunch, right? And so it takes too long for your body to actually go and push, right? But when you're squatting, holding a bar, you're on your side, you're on the floor, squatting, whatever other position for birth are all better and optimal. And that's why I'm very excited to see the biofeedback with electrode and see how my body is doing, to see which position is best for me to give birth in. And I still never took any Tylenol or pain medication. I really listen to my body. I know what to do, the right stretches, the correct exercise when I have pain. If I really have a lot of pain, then I will use a heating pad on my back at night for my sciatica. But honestly, that's gone too, because I'm using the medicine ball to do the stretches and move my body to feel better before the pain starts. The only thing that I really had to change or go around with my workout is the way that my belly is starting to be in the way. So there's some exercise that I can't do, not because it hurt, because the belly is in the way. I also started using a tool, as my pelvic floor therapist told me, and it's been a game changer when I have to be on the floor, when I have to do chores on the floor, when I'm trying to organize under the sink stuff. It's really just the best position ever. And it's a deep squat at the same time, so it helps to open the pelvis. So just a little advice, all tips that are very important to know during pregnancy, because pain is not a requirement of pregnancy.